President Donald Trump has called the House-passed healthcare bill a "great plan," but a new poll finds that 3 out of 4 Americans do not believe it fulfills most of his promises. The poll out Wednesday from the nonpartisan Kaiser Family Foundation also found a growing share of the public concerned that the GOP and APO's American Health Care Act will have negative consequences for them personally by increasing their costs, making it harder to get and keep health insurance, or reducing quality. There is nothing in this poll that, if you were in the Senate, would cause you to rush out and pass the House bill, said Drew Altman, president of the foundation, a clearinghouse for health system information. It was the latest in an ongoing series of Kaiser polls on healthcare. Senators are on recess this week, back in their home states sounding out constituents. In Washington, staffers are working on a legislative framework that can get 51 votes. In the poll, only 8% said the Senate should pass the House bill as it is. The House-passed ACA would eventually lead to 23 million fewer people covered, according to a recent Congressional Budget Office estimate. While it would reduce average premiums over time, it could also destabilize coverage for people with health problems in some states. The GOP bill would eliminate former President Barack Obama and APO's Medicaid expansion and limit future federal financing for that safety net program. It would repeal the unpopular requirement that most people get covered or risk fines. It would continue to provide subsidies for private health insurance, but at a reduced level. And it would cut taxes on upper-income people that Democrats raised to finance their Affordable Care Act. As of candidate and as president, Trump has made reassuring promises about health care. While offering few details, he and APO's vowed to improve coverage and cut costs. Days ago, the president tweeted, "I suggest that we add more dollars to health care and make it the best anywhere. Obamacare is dead. The Republicans will do much better." However, both the House GOP bill and Trump and APO's own budget would make big cuts across a range of healthcare programs, from insurance to medical research. In the poll, 3 in 4 said they and APO's think the narrowly passed House bill fulfills most of Trump and APO's promises. 35% it fulfilled none of his promises, while 40% said the bill fulfills some Trump promises. Only 4% said the GOP bill fulfilled all of the president and APO's promises, while another 10% said it delivered on most of his promises. Drilling down to Republicans, only 30% said the bill delivered on all or most of Trump and APO's healthcare promises. 51% said it fulfilled some pledges. Among independents, only 4% said the House GOP bill fulfills all the president and APO's promises, while 79% said it delivers on some or none. On the plus side for Trump and his congressional allies, the poll found that the GOP base continues to support the House bill, with 67% of Republicans saying they view it favorably. And a plurality of Americans, 42%, expressed support for Medicaid work requirements favored by the GOP. Other findings are not so reassuring. After Trump won, relatively few people saw personal risks from his promised repeal of Obama and APO's health overhaul. Only 28% thought it would increase the cost of their own health care, while 21% said it would worsen access to health insurance, and 19% were concerned about quality. Now, when asked about the GOP healthcare bill, 45% feared their costs would go up, 34% were worried about their ability to get and keep health insurance, and 34% were concerned that quality would suffer. The poll found that the ACA is more popular than the ACA or TrumpCare. 49% had a favorable view of the ACA, compared to 31% who had a favorable view of the Republican ACA. 29% said the Senate should not pass the GOP bill, while 26% wanted major changes and 24% called for minor changes. The Kaiser poll was conducted from May 16 to 22 among a nationally representative random digit dialed telephone sample of 1,205 adults. The margin of sampling error is plus or minus 3 percentage points for the full sample. For results based on subgroups, the margin of sampling error may be higher.